The For Life Center started really with this dream that a lady here in Lexington had, Margaret Gray, probably 10, maybe 12 years ago.
When we first started, it was her dream. You know, she's the one. You know, and that's just the way it is. She is the one. She was the one that put the first money into it. She's the one that said, let's open up a little account with Fidelity.
She's a woman of few words, but when she speaks, she sure makes sense to me.
Always at the forefront was Margaret Gray, and she would see us get a little discouraged and kind of give us her trademark smile and say, we can do this, this can come about, this will happen.
You have certain people, if they didn't step up to the plate, we wouldn't be talking right now. Margaret Gray was one of the first.
This is a dream come true that I started thinking about it 10 or 12 years ago. And it's been all this time, and all these people have been involved in getting it to this point.
Well, it's the first of its kind in the United States of America. And Lexington being a very historic place, it's fitting and proper that a new piece of history is written right here in my hometown of Lexington. It's going to serve for many, many decades, senior citizens all the way down to toddlers, and their lives will be greatly enriched by what happened right here.
A lot of hard work and a lot of dedication and community support is needed to bring something as wonderful as the For Life Center together.
So the Senior Center, and then Rogers came on board. Of course, the Langdons got involved with the child care when they lost the tragic loss of their daughter. And then the school came on board with their plan to put the preschool in this building, train juniors and seniors in the child care area. So that's where the four entities came from. That's where the For Life concept came about.
This project, I could see it was going to help so many people. And for instance, the children in the preschool and the Rogers Lafayette Medical Center is going to have the dental care and so forth. Some of the kids in our county have never been to a dentist.
Hi, Molly. How you doing? I'm Dr. Shaw, and our mission is to treat all patients regardless of income or their ability to pay. We treat children of all ages. We treat seniors. We treat adults.
Samuel Rogers downtown was started back in the 1960s as a community health center. I think the third community health center to open in the entire country for giving medical care to the underserved, people with no insurance, people who are poor, and of course the working poor, or not even working poor, but just the people who don't have insurance, which in these days is incredibly expensive to get, and I would say the majority of the employers here in the area that I work don't provide insurance for their workers. So we're here for them.
Then the idea came, what if we put them all together? And all in one facility, because you have the seniors, you have the health care, and you have children. And who better to work with children than seniors?
I've loved kids all my life, and it feels so good to see them come to that window and wave at us.
It helps the elderly and it helps the children too, because you know children love to be around old people. And you can learn a lot from a child if you listen to him.
In the wintertime, when it was too cold for them to be outside, they'd have the little races down the hallway. It was fun.
I think that the For Life Center offers a great opportunity for all the individuals involved, especially the young children. They are being exposed to our senior citizens. They are being exposed to different professions, and they get these great high school young adult role models that get to come into the classroom. All of these people offer different experiences, and they have a different history that they can share with the young children. So I think it's a very rich program.
I don't know of another project in the country that has anything like this. They have senior centers all over the country, but when you put a medical clinic and you put an early childhood development and you intertwine all of those commitments to these people, it's fantastic.
And it's wonderful for this community because there is so many aged people here now that need to get out of their homes, that's able to get out. But if you don't have any place to go, you can't get out of your homes.
It just means so much, both friendly, socially, and I can help here.
You know, we're not islands. We really need the companionship and the friendship of others. And I think this is going to continue to bring our community together.
Actually, it's an extended family for me. And they feel like a family. They act like a family. They support each other in the rough times, and they help them celebrate the good times.
Everybody's got a different thing that they enjoy about it. But the one thing I think it is, when we get together, we're happy. We're happy here, like family.